You have questions about testosterone, and I have answers. And I think this is really important because I'm hearing some weirdo stuff out there about testosterone. I've heard of doctors that just don't believe in it as a hormone therapy. I've heard of doctors who won't prescribe it, who won't test for it. I've heard of pharmacies that won't fill it. And so we're going to cover all the basics today. We're going to cover like where you make it in your body, what it does, can you test it, and if you choose to go on it, what are the different options and forms that we have available. So, guess what? You make a lot of testosterone. In fact, molecule to molecule, you make more testosterone than you make estradiol, your main estrogen, which can feel kind of mind blowing and wild and weird because we talk a lot about estrogen. Remember, estrogen, I always say, like estradiol, that particular estrogen, that is what truly hits all the systems in the body, makes the world go round for women's health. But as far as molecules, you have a lot of testosterone. It just not discussed over these many years. For some reason, it just became this like taboo subject that we don't talk about testosterone in women, or we only assigned it to men's health, and that's not true at all. So where do you make it? You make it in three general places. First and foremost, you make it in your ovaries. Around each follicle. So the follicle are the cells that have the egg like at the center of it. When you ovulate, you release the egg, but the cells on the outside are the cells specifically that make what we call androgens. Those are your testosterone, your DHEA, another big hormone called androstenedione. So you make testosterone there. And the reason you make it there is because they float inward to the next cell over, and that's where you make estrogens. Some of that testosterone will leak out, about 20 to 25% of it will leak out and go in circulation. Where else do you make testosterone? You make it your adrenal glands. Now, your adrenal glands, you have two of them, ideally, and they sit on top of each of your kidneys. They are what we call like your stress glands. They manage cortisol, adrenaline, noradrenaline. They manage saltwater balance with another hormone called aldosterone, but they also have a layer of them that produces androgens like testosterone. Then you can make testosterone out in the periphery, as we call it. So that hormone I mentioned earlier, that sounds kind of weird, androstenedione, can convert into testosterone out circulate out in the rest of your tissues. So we call it kind of out in the periphery. So you can make testosterone in three places. This is different from men's health. Men tend to make testosterone almost entirely in their testicles, one solid location with a little in the adrenal. Women, three different locations. This is why, as you move through perimenopause and menopause, not all women lose testosterone at the same rate. We think because progesterone and estrogen decline, you would think like naturally if your ovaries are shutting down, so to speak, and you're having like issues making hormones, that testosterone would be one of the hormones that declines. We do know testosterone for sure declines with age, but not all women decline at the same rate. So somebody may be 45 years old with super robust levels of testosterone, hasn't declined at all. Somebody else may be 45 years old and be very low in their testosterone. They're not making robust levels and maybe haven't for years. Testosterone can go down at any age, just like you can have progesterone and estrogen issues at any age. It doesn't mean you're perimenopausal or have crossed into menopause, but it does mean you have hormone dysfunction, and testosterone fits right up there. So if you had low levels, maybe you're listening to this and you're like, yeah, I got tested actually in my 30s. I had low levels then for these other reasons, got it back, and now here we are again with low levels. That's why, because just like any hormone in your body, your testosterone is subject to feedback by that and can be low or high accordingly. So what does it do? Well, it's linked to so many things in the body. Of course, we think of testosterone with libido, right? We think of testosterone with, man, I'm not in the mood. I struggle with orgasm. I don't initiate anymore. I don't want it like I used to when I was younger. It must be testosterone. Testosterone is also linked heavily to bone health, strong bones, to building muscle, to mood, motivation, brain health. I mean, testosterone, I think, does a whole lot more than we're prepared for. I think as research rolls out and expands out of estrogens and progesterone, and we really start getting into testosterone more than what we know already, we're going to find it plays a pretty key role that For some reason, science and research have just neglected in women all these years. Now, what about testing? I mentioned earlier, some doctors just don't believe in testing, and I can understand that. With women, when you're doing testosterone testing, there's different ways we can do it. So you can do a total testosterone, which is all your testosterone. That's what we call bound up, and your free and available testosterone. So total gives you this solid number, and then we can look at your free testosterone separately, and that's a very tiny number. Hormones are like children. They cannot be unattended at any time. So most all of your hormones are on what we call a binding globulin or a bus. So picture your body makes testosterone. It puts it on a bus. The name of that bus is called a sex hormone binding globulin or SHBG. Drives through your bloodstream, goes to where it needs to go, and then the free hormone can get off the bus and bind to the receptor and give you a libido or grow bone or improve your mood. That's what testosterone can do. So we can test all of those things, but we want to make sure you're testing it in something called a mass spec. MASSSPEC. If you are newer, if your doctor or practitioner is newer to prescribing hormones, they may not realize that laboratories have different ways to test. So the common ways through something called an immunoassay, it's not as good. We're trying to move all the labs over into a mass spec instrument, way more sensitive, like way more accurate, I guess I should say, able to pick up the little numbers. The problem is a mass spec machine is very expensive. So some labs have it. So if you get a testosterone and it has a little parentheses MS next to it, it means it was run on a mass spec. You can also ask your practitioner, like, hey, would you be willing to choose the button that it's mass spec? It doesn't mean it's wrong with immunoassay. It's just, I find in my experience, like more accurate if it's on something called mass spec. But this is why you're going to hear the negative feedback from practitioners of, oh, I don't test it because it's such a small number, that free testosterone, it's hard to find. In this immunoassay, sure, but in a mass spec, not so much. When we look at testosterone, we do look at this big picture: total testosterone, free testosterone, sex hormone binding globulin, SHBG. So if you get labs back, you may find you've had a testosterone panel ordered on you, and that's very, very normal. This is assuming you're going through blood work versus something else like urine and saliva, but blood work is probably the most common. All right, when we're looking to add in hormone therapy, and testosterone is part of that hormone therapy, do I use testosterone? Do I like it as a hormone therapy? Is it a primary hormone therapy that I'm looking to add to somebody? Well, this is the big question. Yes, I like testosterone, but I'm going to be very honest with you. I have been looking at the data where the testosterone, or because remember, it's part of that family of hormones called androgens. So in the research, they'll call it the testosterone estrogen ratio, or they'll call it androgen estrogen ratio. Basically, they're trying to get an idea with this ratio, and they don't have a number set for it. It's kind of just like, is testosterone winning on the reference range, or is estradiol winning on the reference range? If somebody is skewed towards testosterone, let's say you have plenty of testosterone left, but hardly any estrogens. Estradiol's not great. They're showing that this can skew someone into more visceral fat, more weight gain around the middle. So I don't want to encourage that to somebody. I'm not saying you can't ever do testosterone. It's timing is everything. So I am a believer in testing, and I am a believer in timing. If you have robust levels of testosterone, but not much estradiol, I'm going to focus on the estradiol and progesterone first and come back to testosterone. But let's say you're one of those people I mentioned earlier, and your testosterone drops significantly right out the gate. Like right away, your ovaries are like, no, thank you, I'm not making this anymore. Then I may absolutely add in testosterone if that's the right thing that we need to do. So I do like testosterone. I do test. I do like timing, and I'm careful in the when I'm looking at labs. Like is testosterone in the middle of the reference range, at the high end of the reference range? Same for estradiol. Like, where are you with your estrogens? Are you making them anymore? Have you been skipping periods and your estrogens are low? Do you have regular cycles? So I have all these questions first before I would put somebody on testosterone. You also have to be careful with testosterone because one, it is considered a controlled substance. To have it prescribed, you can't just get it over the counter. You have to have a particular license called a DEA license to prescribe testosterone. And if you get too much, there is a bigger risk of side effects. Women tend to notice cystic acne, especially around like the jawline or under their jaw, down their chin, etc. They tend to notice hair loss, so male or female pattern baldness. So top of the head, crown of the head, or maybe at the sides, the temples. They may notice hair growth in places they don't want. So maybe increase around, the chin, around the nipple, or down the neck. They may notice a deepening in their voice. So there are some side effects, which is why when I do testosterone, I'm a low and slow type of girl. I don't jump in like, oh, you don't have a libido? Like, let's jump right into the big milligrams and bowl you over. Because I feel like in my experience, that's a one-way ticket to side effects you don't want, need, and you're going to hate testosterone. And you're like, I'm never doing that again. So I'm a low and slow person. The average milligram range for testosterone, if you're doing something like a gel, which is probably the most common topically, is 0.5 milligrams up to 5 milligrams. So if you are a sensitive little bunny, then I'm probably going to start you with the 0.5 milligrams, and then we can adjust. Right? But if you have been on testosterone a while and you're just listening to this and you're thinking, no, I'm pretty robust, I've been at 2 milligrams, but I don't think that's enough, then definitely you're the person you talk to your practitioner, maybe double it to 4 after talking with them. But you can see there's this big range, but we can start low. We can start low and slow. You don't have to jump in with the big, 5 milligrams or 5 milligrams plus. All right. With testosterone, having said that, there is no FDA approved form. I know, wild, right? Like, we still as women don't have an FDA approved form. Are they working on it? I'm assuming. Are you going to get it soon? I don't know. I'm assuming. I mean, I think at this point, with the amount of press and social media and the books and the money being poured into research, that some pharmaceutical company somewhere is creating actual testosterone at women's sized doses, which is much smaller than a men's dose. But we don't have it yet. So what do? We use it off label. So your practitioner might prescribe to you the men's gel, the men's testosterone gel, which comes in these packets. And depending which packet you get, so for example, you might get the packet that says 50 milligrams per 5 gram packet. And they're just these little packets. They're kind of they're kind of the size of a packet of like a triple antibiotic might be in, like a travel triple antibiotic might be in, if you've ever seen those, or if you cut yourself, like something that would have a gel in it to put over to stop an infection, that's like travel size. That's what they look like. So it might say something like 50 milligrams per 5 gram packet. Well, 50 milligrams is in the whole packet. What did I say? 0.5 to 5 is what women on average use for testosterone. So this is why you will hear educators say, if you use the men's gel, you're going to use 1/5 to 1/10 of the dose. So if it's a 50 milligram in the whole packet, well, 1/5 of it would be 10 milligrams. That's kind of a lot. But 1/10 of it would be 5 milligrams. So that's an option. And men have different doses of packets. I'm just giving you like the most common that you probably see or people post on social media of like, this is the packet I have and this is how much I do. If you're wondering like, why is that a tiny little dab? That's why, because they're doing 1/10 of the packet. Now, you rub it into thin skin. So you would, in this case, you would, like cut the packet a little bit, and then you would maybe on the inner wrist, your inner arm, around the elbow, and you kind of rotate sites. They may tell you other sites to do. Listen to your practitioner, listen to, what the pharmacist says. But that's generally how it's done. Now you have to be careful. We don't want men to transfer their gel to us or children or the cat, the dog, the animals that you have. It's the same way. Like rub it in, let it dry for a while, like give it like fully dry before you go hugging and picking up and touching and loving all over. You make sure you wash your hands really well, because like testosterone's transferred very, very easily. Actually, all the hormones are transferred very easily. But I've actually talked to vets who said, we know if somebody's using topical hormone, that the animal can pick it up and it can show up as symptoms and side effects for them as well. So just be careful. I'm not, it just is something we have to be aware about. Rub it in really well, wash your hands, let it dry before you go, bearskin on, like, hugging your cat or your dog or your child, etc. Now, if that packet idea doesn't work for you, let's say you're like, oh my gosh, what a pain. How am I going to figure out a fifth to a 10th? Can't I get it specifically made for me? Yes, this is when we use compounding pharmacies. So, as I've said before in other episodes, compounding pharmacies are pharmacies with pharmacists that make it just for you. So, they use the actual testosterone, just like the testosterone that would be in the men's packet, but they dose it down so that it's your dose for you. So, like, let's say there's certain, like a click form, which means it's this thing you twist the top and like it clicks and then it pushes out a little bit of hormone. You would know, like, let's say each click out is 1 milligram or 0.5 milligrams or 2 milligrams or whatever you're doing. So it's pretty specifically dosed. Now, how they make it, when it's compounded, the end product is not FDA approved, even though the testosterone going in there is true testosterone. With the men's product is testosterone, and the product is approved for men, but women are using it off label. So you can see how it's getting kind of complicated here. Like I said, oh my gosh, hopefully at some point we have some sort of FDA approved version for women. But that's how the testosterone currently is dosed. So if you see on social media where it's very common for educators and influencers or just women in general who are in perimenopause showing you their hormone stack, they will hold up a little packet and they will say, and I rub on a little dab of this or a tenth of this, or they'll hold up something that's dosed specifically for them. So I'll do one click or one push, and that's my testosterone. It's usually a gel. Now, can testosterone be used vaginally? And the answer is yes. There are a lot of indications to use it vaginally. You've heard about estrogen vaginally because of dryness, because of lack of lubrication, because of urinary tract infections, because of the whole genitourinary syndrome of menopause, GSM. We're trying to preserve all the tissue down there, make everything luscious and juicy and good through all of your years. Androgens like testosterone and DHEA can also help with like muscle strength and tensility. Not as much for the lubrication aspect of it, but like my pelvic floor physical therapists say, like, we can tell a difference when women in the pelvic bowl, when women use estrogen, but especially when they add an androgen with it. I get that feedback a lot just from women who are like, I loved my estrogen, but once we added in the DHEA or the testosterone, then, oh my gosh, like that just really, really helped with strength, being able to hold my urine, being able to like not feel like if you a little bit of tiny prolapse, which is where maybe part of the uterus or the bladder, depending what kind of prolapse you have, feels like it's just because of like little loosey-goosiness, like you're sort of coming out. I have had women say that they notice the difference in just stronger muscles down there, and less of these menopausal type side effects. Now, DHEA is actually FDA approved. You can get that. There's an actual FDA product out there that's 6.5 milligrams. I'm aware DHEA is not what we're talking about today, but it is under the umbrella of an androgen hormone. There is no FDA approved vaginal form. So there's no gel topically to put that's systemic. There is no vaginal form either, but a lot of people just get it compounded so that you could do a suppository or, a gel or something that goes vaginally to help support all the muscles in the whole pelvic bowl. So hopefully this helps answer a lot of testosterone questions. My whole goal is that you can go armed, prepared, proactive to your practitioner, or when they talk to you about testosterone, you're like, yep, I fully understand everything you're saying. I listened to this. I'm aware this makes sense. And then you can decide, yes, I'm ready for it, or no, I'm not. Or maybe you're just curious. Maybe you're like, my testosterone is great. I'm doing wonderful, but I am kind of curious where it's made. I am kind of curious what it does in the body. And I'm kind of curious if I do ever choose to go on it, what might be the side effects. Last thing, because this is important, not everybody gets the side effects. I know the side effects sound awful. Nobody wants hair loss. Nobody wants acne. Nobody wants like a deep voice. But again, not everybody gets that. I just have to tell you what the potential side effects are if you get them. So it's not an absolute. So just if you're already losing hair because of thyroid or stress or low other hormones, it doesn't necessarily mean going on a little bit of testosterone is going to worsen that aspect. It might, but it doesn't necessarily. There's a lot of benefit to using testosterone if you need it. So hopefully this 101 on testosterone answered a lot of your questions, because like I said, it's kind of feeling like the wild, wild west with hormones out there. I'm getting a lot of really interesting feedback of my doctor said this, my pharmacist said this, and I'm like, what? We do know a lot about testosterone. I don't get why they're being weird about it or giving you some pushback. Now, as usual, I understand. Testosterone and hormones in general are like herding cats, but I'm here to help.